Hello and welcome to Tuesday Talk. It has been a while since I've been here with you guys. Thanks so much for everyone who's joining us. Again, my name is Aaqil Khan. I'm the director of Project Open, which is a federal grant aimed at addressing the opioid epidemic, but more broadly, substance use disorder and addiction in our area. And not just specific to our area, but we are developing tips, strategies, techniques, tools, programming that can be used in any community across the country. We operate in, again, three main domains: prevention, treatment, and recovery. And I'm very excited today to be focusing on a treatment topic, but there's also a prevention component of it. And I'm excited to bring with us today Mr. Chirag Rathod. Chirag, welcome to the show.
Hey, Aaqil, thanks so much for having me.
Hey, we're really excited. I'm excited to talk about the interesting topic we have today, Illinois Advance. But before we get to that, would you mind telling us a little bit about yourself, sir?
Sure. Do you want me to go back to the day I was born, or should we start with my
If you'd
profession?
like to, it's up to you.
Yeah. I'm a clinical pharmacist and an academic detailer with the University of Illinois Chicago and Illinois Advance, which is behind me. It'll actually be 10 years at UIC this August, which is pretty wild. Thank you very much. Over the last few years, we've been focused on academic detailing, which we'll be talking a lot about today. Um, for myself, a lot of my work focused on academic detailing is meeting with prescribers, doing the educational outreach, giving presentations to different organizations as we're trying to get them involved in doing academic detailing, training staff, so new staff that have come in to teach them how to do this educational outreach known as academic detailing, facilitating role plays with my own staff, meeting with staff individually to talk about different strategies on how to effectively academic detail, and all sorts of stuff. Lots of different hats are being worn.
Yeah, no, you. I remember when we started this process, we were meeting with some of your colleagues, and you came in, and you are most definitely what I feel to be the quarterback, kind of, with all the academic detailing colleagues and all the folks, the wonderful folks at University of Illinois College of Pharmacy, College of Medicine that we've been working with. So thank you very much for that background. Now let's talk about Illinois Advance directly. Now you've talked about academic detailing, and what we're going to learn is that there's many different forms of academic detailing. For our Project Open, we're going to be talking about opioid academic detailing, but we'll put a bookmark in that for a moment. Illinois Advance, celebrating 10 years. How did it start? What was the history? What's it grown to today? What's its mission, vision, goals? I mean, what's it about?
Yeah. So Illinois Advance is relatively new. My history at UIC is about 10 years. Illinois Advance came into existence kind of starting in August of 2019. But maybe I can backtrack a little bit and even talk about academic detailing a little
Yeah,
bit first, if
please.
that's okay.
Yeah.
Academic detailing is educational outreach. What makes academic detailing truly unique, and what I think is really cool about academic detailing and sort of differentiates it from other forms of educational outreach and training, is that academic detailing is tailored to prescribers. Traditionally done as one-on-one visits with prescribers. In some situations, we do small groups, but we want to tailor these visits to the prescriber. I want to learn about the prescriber's approach to management and to care, and then provide tools and resources that are specific to whatever struggles or successes they may have in managing their patients. In the state of Illinois, there was a public act that was passed back in August of 2019, which was a Public Act 1010978, which essentially led to the creation of Illinois Advance. But detailing at UIC started a few years before that. It started with one of our research departments at UIC, the Pharmacy Systems, Outcomes, and Policy Group, PSUP. They started a small CDC-funded project that focused on one health group and about 151 prescribers, and found some pretty positive results in this approach in creating some practice change. That led to some more funding and an expansion of that project that then led to this law being passed. And now our group here that's trying to do this sort of educational outreach in the whole state.
That is huge. And so I like how you're mentioning it's the version that we're going to talk about today is a little bit more relatively new, Illinois Advanced, but there's been academic detailing happening informally, formally for many years prior. Now, locally, for those who don't know, we're going to be engaging in opioid academic detailing. Because again, Project Open is really focused in how do we reduce the average day supply of opioid prescriptions? How do we better educate providers and patients on pain management, alternative strategies? And so, can we talk about, if you're available, can we talk about opioid academic detailing and kind of the process that we're going to be doing here locally?
Yeah, we're actually really excited to work with your group. I think what Project Open is aiming to do, which is make this collaborative effort and having multiple people sort of move in the same direction when it comes to safe opioid prescribing and just overall like safe management of our patients. I think that's really beautiful. I think one of the challenges is getting multiple people on board and moving in the same direction. There was a conference I went to in Rockford many years ago that was trying to get all the prescribers in the area to have similar approaches to managing patients. And so I think what your group is doing is really beautiful. So we're quite excited in being a part and an element of the overall mission of Project Open. But yeah, we're going to be focusing on opioids and a few different topics within the realm of opioids. From a high level, talking about the prescription monitoring program, naloxone, talking about opiate alternatives in a few in specific conditions, including chronic back pain and osteoarthritis, and then opioid use disorder as well, and the many elements of opioid use disorder, from tapering to medications used for opioid use disorder, medications for opioid use disorder, excuse me, and a few other elements of that. And again, trying to make it tailored to the things that are specific to the prescribers that we're meeting with. But from a high level, those would be the things that we're trying to touch on in our detailing visits.
No, that's perfect. And I'm going to dive a little bit deeper into those visits and kind of our format, so our friends who are listening can understand. And what I want to actually offer to the folks listening is, how do we get to this point? So we started with a $200,000 planning grant in 2018. And in that process, we did one of the evaluation tools we deployed was the key informant survey. And we surveyed individuals who were actively using, who identified as actively using, or who identified as former users. And we asked them, where did you get your original supply of opioid prescriptions? And the common belief at that time by many parties was that this is some sort of black market, street drug dealing type incidents. But what we learned was nearly half, 47% of the respondents identified getting their first opiate supply from their doctor's office. And that's when we kind of had that shift in thinking, like, hey, look, this is going to require a multi-pronged approach. We can't just look at the law enforcement crime side of things. We got to look at how it's starting oftentimes innocently. Grandma, parent, child, whoever it might be, goes to visit the dentist or doctor, and they receive an opiate prescription supply where maybe it's, now we know 5 to 7 days is appropriate and refill the prescription. But a number of years ago, we might have been giving 20, 30 supply of prescription pills, and that wasn't necessary. And so then we had these, pills laying around. Oftentimes, due to lack of health literacy or education, individuals were taking that entire supply, even when half or less were needed. And then that is when the initial hook and cravings began. And then before you know it, there was a substance use disorder that had to be addressed. And so we realized that, hey, look, not only do we need to look at the informal street drug side of things, drug dealing type side of things, but more importantly, we need to look at the prescribing side of things. That we didn't give emphasis to that. Well, how do we do that? And that is when we became aware of opioid academic detailing. And our format is going to be pretty neat. Chirag, do you mind talking about how we're going to stagger these visits and kind of the data that we might be tracking? And then ultimately, you've done this already before. What value have you seen that has come out of this?
Yeah, for sure. So one of the cool things about academic detailing is that we are trying to build relationships with the prescribers that we meet. And I use the term prescriber to include physicians, nurse practitioners, physician's assistants, really anyone that can prescribe opioids. But the goal of the sort of larger goal of academic detailing is to build relationships with prescribers and ultimately become a resource that prescribers can use. So, I'm not there only when we meet. I'm available after we meet, following up with whatever questions can come up, providing resources, trying to connect prescribers with other resources in the area. And so for this project in particular, our hope is to do 3 visits with a little bit of time in between each visit. Some of that is to let the content that we share, sit in and marinate, allow for some potential changes to happen in practice if we talk about some things that may be integrated with your patients. I think the plan is over a 6-month span, but we're pretty flexible in that timeline. But the goal would be those 3 topics over a relative 6-month timeline.
And then the data, if you don't mind me asking, are there any metrics or key performance indicators that would be a part of this process?
So in some of the earlier iterations of this, of detailing with some of the other groups, they did look at prescription monitoring program data to see if any changes had been made. And I think one of the things we want to be careful with when we do detail with prescribers is not come in trying to force any change or come in saying that prescribers are doing anything wrong. I think one of the things I like about detailing is that as much as I get to share information, I really do get to learn a lot about the struggles and successes. And I find that very valuable as I sort of continue to be a practitioner, meet with other prescribers and learning the challenges of tapering someone on opioids, or the challenges of integrating alternative agents that, as good as it sounds on paper to switch someone from one agent to another, there are real life challenges. If someone's been on opioids for a really long time, it isn't as simple as just switching. So I want to be mindful of that as we do a lot of this stuff. And I know with some of the institutions, there's some internal data that we might be able to obtain, but maybe that's Aaqil, something you can speak on a little better.
Oh yeah. So you nailed it. Definitely looking at prescriptions, looking at dosages, looking at average day supply is one of the main things. And you nailed on something that's very important, is that the whole purpose of this is not to go in and say, you're doing something wrong, prescriber. You need to change what you're doing. Opioids play a valuable role in patient care. It's more so education and awareness. And that's what I think the early feedback from our pilot groups was huge, is that, and I think a lot of people might have been a little defensive or apprehensive. What are you going to do? You're going to tell me that I'm not practicing medicine correctly? But it was the exact opposite. Share with us how you do it. Here's some resources. Here's some things. Let's log into the Illinois PMP. Look at your data. Look at all the different dashboards, the different tools. Immediately, guard went down. It turned into a conversation. I know we're trying to keep some of these meetings to 15, 20 minutes, but prescribers are holding longer and asking more questions. And when are you coming back? And again, survey data, both subjective and objective. And so I think that's really key, is it's not change what you're doing. It's just, know what you're doing, see what you're doing, collect data on what you're doing. Here's what your peers are doing. And what we're finding is that the questions then start flying is, how do I do that with co-occurring disorders when they're using this medication with that medication? And that's where you and your team I've seen really come shine through on some of these early pilot visits.
Oh, thanks. Yeah, the early studies that before our team got involved too, some of the results they found were very cool. They found reductions in 1 opioid prescription per clinician per month, which is like modest on an individual basis. But if you extrapolate that out to the patient population, or to the prescriber population, you're getting, I think it was 1,500 pills potentially reduced per month. And so that's a lot, and our hope is to expand on some of that work that they did, and just, sharing, good information, trying to work on strategies to improve patient care is ultimately what we want to be able to do. Because I think with opioids, I don't know if we're necessarily sharing new information as much as just like continuing that conversation, talking about it more, making sure it's still top of mind, finding new strategies, maybe re-engaging in conversations that aren't being had, sharing new tools. The Illinois Prescription Monitoring Program has a tool on their website known as MyPMP, which gives prescribers high-level information on all their patients. So being able to look at all of your patients that may be on opioids and certain patients that may be at risk, higher doses of opioids, multiple opioids. So that sort of information, we've been finding it's just kind of new to prescribers. And so being able to share that with prescribers for prescribers to be able to make more informed decisions on their care is like really what we want, more informed decisions, more like, with the overall goal of patient safety.
I like what you said. There's so much data out there, but taking that data, turning it into information, is what the key focus is over here. And if I can rewind a little bit to the history, and we've had some folks on the show prior to it that have talked about, well, how do we even get to this point, right? I mean, they've talked about pain as the fifth vital sign, then leading. I mean, can you talk to us a little bit, in your opinion, Chirag, is what do you think has led to the opioid epidemic in your pharmacy experience?
Oh, that's an interesting
It's a
question.
loaded question. So, I mean, maybe from your angle or how you see it, that has led to opioid academic detailing being something that prescribers really should sign up for.
I mean, I think that there's, I think one of the things that's like extremely challenging with opioids is it's like pretty, it's like pretty complex. There's so many different things happening. There's the actual prescribing of opioids. There's like all these societal factors that exist that lead people to wanting to seek other ways of, feeling better and finding sort of happiness. And so that's happening. There's, pharmaceutical companies have been sued for some of their practices. And now states are starting to sue pharmaceutical companies and like trying to, get some money back. So there's like so many things happening that it's like really complex, and like detailing isn't the, only answer. And the hope is, from a, and you talked a little bit about it, like pain was talked about as the fifth vital sign, and certain medications were highlighted to address that. And what we want to do is just talk about the many options that exist. If we're talking about from a pharmacological perspective, talk about opioids, talk about non-opioid medications, talk about non-pharmacological means as well, and just seeing what prescribers, in a detailing visit, I want to get an understanding of what prescribers use in their practice. And so if they aren't using non-pharmacological medications, it's not, or non-pharmacological approaches, it's an opportunity for me to maybe learn, like, why they aren't, what are the challenges in getting patients to start some, non-medication approaches to care. But yeah, I think there's a lot. I mean, I think detailing is a chance to just like, bring forth evidence-based information. Some of the societal things are pretty challenging. I don't know if detailing can fix that, but hopefully it's just one of the ways to try and address that.
Well, I mean, so that was a curveball question I threw at you to see how much on your toes you were. I know you didn't prep for that one. You nailed it. I loved your answer. The societal factors, agreed, is going to be hard to answer in this one single prong approach. However, by having these conversations, it's awareness. And so providers, prescribers, anyone on that care team or anyone that these individuals are interacting with may start to keep that at forefront of mind, is what else is going on, right? Because we oftentimes treat the symptom, or we are, addressing just that one issue that we're looking at in isolation, not looking at the whole picture. And I think that with social determinants of health, with embedding social workers in clinic practices, that shift is really starting to happen, and looking at the whole person holistically, all the other factors I might be attributing to their current state, and how do we improve so that quality of life is higher coming down the road. And so, a really good answer over there. I really enjoyed that.
I think it's important, we are trying to like look at the person as a whole when it comes to care. And that's huge. These things are not like, as we're detailing on a lot of these different topics, they're not like siloed conditions, and like a person's like at home life affects all these other things that happen. Right. So that's a beautiful approach that's happening in medicine, and has been happening for quite a while, of looking at the person as like more than just the condition. They're an individual who has it, but they're like, they're complex, and we need to account for all of those things.
So I got two more questions on the opioid academic detailing side before I move on to other types of detailing. First question is, what type of specialties do you feel benefit most from opioid academic detailing?
So I think definitely, like, as silly as this is gonna sound, like, prescribers who prescribe opioids, like, just from a value of conversation from both ends, like, there's more that can be talked about with someone who prescribes opioids, because they prescribe it. So like, I can learn from them a lot more because they're dealing with it on a day-to-day basis. But I think there is value in more people being aware of just the different elements of opioids. I've met with prescribers who manage children, but the children have parents who are struggling with opioids, and they've found it interesting just to learn a little bit about what like the state of opioid management or like pain management is. So I think that there's, that group can find value as well. I mean, anyone that's interested in learning, we're open to talking. But I think definitely, focusing on the areas where people who actually prescribe opioids, I think is of the most value. But, as you might have said this earlier, but, awareness is huge. And, if we're talking about naloxone, I mean, that's a conversation that many prescribers can have with their patients. But yeah, I would say, definitely someone who prescribes opioids or works with pain, or like pain, someone who's managing patients with pain. Because if a prescriber is able to manage their patients with pain and aren't prescribing opioids, that's very interesting to learn. How did you get to that point? Like, how are you able to, convince your patients that opioids aren't the way? How are you able to taper them? There's a lot for us to learn as detailers as well. I don't know everything about all the, how to manage opioids. And so I'm here to learn, to be able to share good information, to eventually integrate it into how I am as a detailer, to be able to share that as well.
So in summary, whoever prescribes opiate prescriptions, we know commonly these might be family med, internal med, general surgery, OBGYNs, maybe a little bit of neurology. But to your point, detailing all prescribers, even those who may not be prescribing opioids and opiates, you learn from how they manage patients with pain. And so we're pretty excited. We are starting with the low-hanging fruit, our primary care physicians, family med, so on and so forth, and then moving down the list to more specialties that may not do as much chronic care management, and so the last question I had on this is, you mentioned providers having conversation with their patients. What type of conversations should patients be having with their providers as it relates to this topic?
Oh, that's a good question. That's actually not really something I've thought about as much. But I think part of like trying to have a more holistic approach to patient care, the push is like making patients more involved in their own care. So not just being like, told, go take this medication. Yeah, it's a switch. And so I think by empowering patients to like be involved in their care, you can have a prescriber told me that one of the ways that they were trying to focus on pain management for their patient was understanding what did they want, what was their goal overall, like why were they on opioids, what were they trying to achieve. And so one patient had said something like, I want to be able to play with my grandkids or whatever, or I want to be able to walk up the stairs to my bedroom. So that becomes this like touch point that they can always go to, and hopefully that allows open conversation about if that goal changes or if they're not achieving that goal, what can be done. So I think just trying
or even alternatives. If your goal is to play ball or be able to walk up the steps, maybe we look at PT. Maybe we look at other approaches. Maybe it's just not pain medicine to help you manage that pain going up the stairs, but strengthening and then attacking the root cause of the issue or their desire. I love that.
And I'm sure there are challenges, like, and again, like, if you have very limited time as you're meeting with your patients, that's a lot of stuff to talk about amongst many of the other things that you're talking about. And so same with detailing, like, we want to build that relationship. So this conversation doesn't have to happen in that one visit. It can happen in our subsequent visits through emails. And so, yeah, just that same approach, if prescribers are able to do that with patients. And I've spoken to many prescribers who are trying to sort of create that like open conversation with patients. And it's a beautiful thing. It's really, because I just come in and talk to you about stuff and then I leave. Like the prescribers are the ones that are really doing the groundwork. And so it's really cool to hear that that's happening and being done. We just want to help like facilitate that and share things.
No, that is absolutely dynamite. So we've talked about opioid academic detailing, but Illinois Advanced has a lot of other academic detailing programs. Can you talk about the other ones?
Yeah. We do. So we started with opioids because when the detailing began at UIC, before we even got involved, was 2017, 2018, sort of a few years out from the CDC guidelines coming out, which are actually in the midst of getting updated. So we started with opioids. We have topics on type 2 diabetes, or we have a detailing brochure, on type 2 diabetes. We have asthma as one of our topics. We have smoking cessation as one of our topics. We are working on an HIV and STI educational brochure. We're, I believe, working on some HPV vaccine information stuff. And our hope is to continue to create, topics. Continue to update the topics we already have as things begin to shift. But really doing, chronic conditions that are of. We also have a neonatal opioid withdrawal syndrome brochure now
Okay.
as well. So a lot of different topics. And yeah, so opioids aren't the only topic we're covering. We want to be able to cover a variety of conditions, as we've said a few times, in particular with at least our involvement with Project Open in the beginning. Opioids is going to be the topic of focus. But we do want to, we want to, like, our goal is to be like a primary resource for
Yeah, that's
prescribers. And yeah, so we offer like, outside of just the detailing, we have well, you can earn continuing education credit in
correct.
meeting with us, which will be provided as part of the being
Yep.
involved in the Project Open. We have just online CME credit that can be obtained. You just have to like do the CME. We have a drug information group here which is housed at the University of Illinois in Chicago, which if prescribers have any questions on really any topic, they can submit an inquiry and get an answer within about 48 hours, I believe. So outside of just the detailing and the meeting one-on-one, we have a few other resources that are available as well.
And what we thought, from a partnership standpoint, as you mentioned, what's key is that you're building that relationship with the providers. So we plan to, here in our area, start with the opioid academic detailing, but then all the ones you mentioned: asthma, diabetes, HPV, smoking cessation, be able to offer that because you built that relationship, and it's just continuing education. And for the opioid academic detailing, anyone who's in our Sauk Valley area, Project Open area, so KSB, CGH, Rochelle, Morrison, prescribers, including dentists and everyone in between, they're available to do this program with us free of charge and receive up to 1.5 CMEs when you complete each of the 3 visits, each valued at a half CME. So that's going to be really valuable. Not only are you getting the education, the awareness, the connection, the relationship, but also CMEs for your continuing education. Let me ask you a question here, Chirag. Is what active projects do you have right now that Illinois Advance is doing that you feel are important to share?
I mean, really, those detailing topics are of, I would say, like the primary thing that we're doing. I mean, we're going out and giving presentations to different groups to try and get them involved. We sort of like, our growth really happened right kind of in 2020, so like as things were starting to shut down, and so like we're still in this pretty heavy process of getting our name out there and letting people know that we're available. The UIC name, people are pretty familiar with. Illinois Advance is pretty new. Cold calling clinics and trying to explain who we are and what we're doing is can be challenging in its own right, just because people just don't know who we are. So that's like one of our biggest pushes, is just trying to get our name out there. But a lot of the detailing, I would say the detailing efforts is probably our biggest thing. I mean, with diabetes, a lot of change has been happening over the last few years with these like shifting in guideline and pretty, paradigm shifting approaches to care. And so that's like a big push that we're trying to do. With smoking cessation, it's trying to like re-engage in a conversation that maybe has been happening for quite a while, and so just sharing some of that stuff. With asthma, there's been some changes to the guidelines, and so really just trying to do more of the detailing stuff is probably like our biggest project that we're working on right now.
And so we're going to be working with you directly to help eliminate one of those barriers of cold calling offices. So we've got our list of all our providers at KSB, CGH. We're working through all that, getting office manager contacts so we can begin expand beyond the pilot and get to providers in all of our areas. But those who are in between, those who we haven't gotten yet to, or those across the state, how would they get a hold of you?
So there's actually thank you very much. So that there's a few ways that you can connect with us, and we put a lot of effort in our social media outpouring. So we're available on Facebook, Twitter, and LinkedIn. That QR code, if you scan that QR code, it'll actually link you to all of our social media pages. It'll also give you the opportunity to set up a visit with us if you're interested in doing that. Our website and our email is below. If you want to take some time to think about it or wanted to reach out to ask us more questions, you can message us on any of those social media platforms, and we'd be happy to talk to you about our program as well. And Aaqil just put up our website as well that you can check out. So there's a lot of different ways to reach out to us for those of you that are in between.
So, I mean, this has been incredibly informative. We're really excited to have your partnership, and we've been trying to find ways to do this internally. It's such a big project to to attack. How many folks exactly are on your detailing team?
You actually read my mind. I just wanted to give a shout out to our team. So I think what the strength, or one of the strengths of Illinois Advance is that our team is enormous. We have 30 pharmacists who are academic detailers. We have 3 pharmacy technicians who do a lot of the helping us set up visits, and then we have our 2 of our bosses as well. And so we have a big team. So 30 detailers, who most of us are located in Chicago. We have a few in the southern part of the state, but we're pretty mobile. We move around quite well. So a large team, but and all the brochures and all the content that we share on our social media, all the content that we create, all of it's made in-house. So people learning how to design these beautiful brochures that we create. That slide that you saw, I can't take credit for making it. That was some of the members on the team who are much more they just make better PowerPoint presentations than I do. And so they put that together. A very large team of detailers.
Well, again, I really appreciate your time today. I was super excited to get this officially off the ground, and just get into all the offices. And I know we're just a few days away from being able to do that. Are there any closing comments, thoughts, questions about Project Open, the opioid epidemic, academic detailing, Illinois Advance that you'd want to cover before we go today?
Well, I think I can speak for my team, in that we're very excited to be involved in a push like this, and really trying to, improve our patient care in a collaborative effort. We want to be a resource to you. We want to make this valuable to you in any way that we can, and hopefully improve our patient outcomes. So we look forward to working with all of the prescribers that are involved in it. So please reach out. Aaqil had just had our social media page or links to our social media up. So feel free to reach out to us, ask us questions if you're curious about anything. We'd love to talk more about all this, and eventually, ultimately, love to meet with you in a one-on-one visit and give you some experience in what it's like to be detailed by myself or one of the members of my wonderful team.
And I think the way we'll end today is, they may not know it yet, but most of them are going to be seeing you or one of your team here in the near future.
You will see this face again,
whether they like it or not.
Hopefully they like it, but we'll see.
I think there's no doubt after the first 5 minutes they'll be begging you to come back as soon as possible, because again, the information that you have shown, and me and my non-clinical mind was able to digest it and understand it and really think about it critically. In the Q&A section, again, we're equally as excited to finally have a large team to be able to support this initiative, because Project Open is looking at doing this at north of 150 providers in our area. We want to make sure that we are doing everything we can to attack this opioid epidemic and substance use disorder from all angles. Here's our treatment approach with a little bit of prevention topics and everything sprinkled in. So with that, Chirag, I really, really appreciate your time today. We're excited to meet your team here in the coming days and weeks. And again, Project Open family, if you ever need to get in touch, here's the information. Chirag, you want to send us out?
Thank you so much, Aaqil. It was an absolute pleasure, and I look forward to working with all of you in the very near future.
All right. Everyone, thanks so much for joining in on this Tuesday talk. We'll have one coming up in the near future. And until then, peace and love. See you.